Welcome to the latest episode of the Crann podcast. This time around, I'm leaving you in the capable hands of Crann's Research and Impact Lead, Dr. Alice Moore, who spoke with Dr. Teresa Eckrich Sommer recently about two-generation approaches. Dr. Sommer is a research professor at the Institute for Policy Research at Northwestern University in Chicago, Illinois, and co-founder and director of Northwestern's Two-Generation Research Initiative. She's a leading scholar in the field of two-generation strategies like the one Crann uses to offer children and adults with neuro-physical disabilities and their family members support and services. Dr. Sommer specialises largely in its use for economic mobility, but is working with Crann on our innovative approach, applying it to disability services. This is a term you'll likely have seen us use a lot, and Alice and Teresa have given us a great explainer and overview of the impact of these approaches. I'll hand you over to Alice now. Enjoy.
Welcome, Teresa. So can you tell us a little bit about who you are and what you do?
Yeah, absolutely. Thank you so much for having me. Teresa Eckrich Sommer. I am a research professor at Northwestern University, which is based in Chicago, Illinois. And I also am the director of something called the Northwestern Two-Generation Research Initiative. So I've been studying two-generation programs and interventions for the last 16 years.
So there's an awful lot known about two-gen approaches, but there's also not a lot of information in terms of the Irish context. So can you describe what a two-gen approach is or a two-gen model of care, please?
Absolutely. Most broadly, I think of it as a family-centered approach, so it's really putting the family at the center of care. In my particular work, I would say, particularly in the United States, there's a broad range of inclusivity of in types of programs. What we largely study are programs that invest in the development of children and of adults with a goal toward economic mobility. So we do have a piece that is really about social and economic mobility, but it's really looking at what are the synergies between parents and children, how can you harness them to help them both reach their educational goals. Yeah.
So you spoke there about family-centred care, which we hear a lot of in the Irish context, but really what seems to set it apart is focusing on at least two generations of the one family.
Exactly. Often we say, my grandmother could have told you that. Of course, parents influence children and children influence parents. But we also know, for example, for children, the biggest driver of their educational success is the education of their parents. And so outcomes in both directions. Parents influence children and children influence parents. And one of the things we really care deeply about is the fact that children are often a major motivator for their parents to improve their own lot in lives, whether that be through education, career, or overall well-being. And then we know that that in turn influences outcomes for children.
So you spoke there about outcomes in both directions. So why are two-gen approaches important? What are the benefits of two-gen?
Yeah. So it's really taking advantage of what we call synergies or the dynamics that happen between parents and children. Of course, those can go in positive or negative directions, and we're talking about harnessing those positive directions. So parents can serve as role models for their children. They can have skill sets they share with them, resources they bring to the family, financial and otherwise. And then children, we also like to think of it as, sometimes in certain contexts, like say, for example, in workforce training, children might be seen as a barrier to parents receiving their education and achieving their career goals, but we turn it on its head and say, children are a major motivator for parents to improve their lot in lives. No parent wants anything but the very best for their child, and so that's one of the really important synergies we're trying to harness.
Thinking about synergies and dynamics then, what are the differences between a two-gen approach and standard care?
So standard care is really what comes out of a system where our funding and our delivery of services and the training for the individuals who provide them are really focused usually on a single generation, particularly in education. Of course, there are schools for children and schools for adults, but we don't think much about how those interrelate and how can one family handle, in this case, whether it be the healthcare or the education of each of those individual family members, and see the ways in which they affect one another.
So then thinking about we understand that single generation approaches are well established globally. What are some of the challenges for adopting and implementing a 2-gen approach then?
I think what often happens is you might already be well steeped in one approach. Say, for example, you work in early childhood development and you're very focused on children and their well-being, their outcomes, and you want to adapt a 2-generation approach. It might be that there isn't the expertise among the staff to think about adult development. It might also be that it's very complex to get funding from multiple sources to sustain your organization. And I think you need to really create a culture where the entire staff believe and understand in those ways in which parents influence children and children influence parents. And if that doesn't happen, then you end up often providing possibly high quality services for one generation and less high quality, less intentional for the other.
So thinking then about that need for a real expertise, the complexity around funding, building that culture, what is it about a 2-gen approach that makes it worthwhile?
Well, I think that you're likely to get much better outcomes. The studies that I've done, both short-term and longitudinal studies, suggest that when you invest in both generations, you get better outcomes for both rather than the outcomes for a single generation.
It makes sense when you think about it, and thinking back to your reference to your grandmother.
Yes.
She could have told you the same. So just to remind our listeners that you're based in the United States, but a lot of collaborative work happening internationally. So can you just tell us about what has been the most rewarding aspect of your 2-gen journey so far at a professional as well as a personal level?
Well, I would say professionally, I take from a theoretical point of view, believing that children influence parents and parents influence children, and then I get to see that in a real way on the day-to-day in these organizations. And so that's super powerful to see. I would also say that the chance to do really in-depth partnerships with local providers and organizations is extremely rewarding for me on both a personal and professional level. You know, when I originally went into research, I wanted to make sure that I didn't just focus on the numbers, but be close to the phenomenon of what's actually happening. And it's just been incredibly rewarding to see changes in families over time, to be able to document them and then to actually use that to influence policy.
So you spoke there about the in-depth partnerships and the work that you do globally with lots of organisations. So just for our listeners, can you briefly tell us about the work that you do with the Crann Centre?
Absolutely. It's interesting. Any organization that's really willing to take on a 2-generation approach has got to be innovative, dynamic, and passionate about what they do. And so the organizations I've worked with in the United States, I've had that example. And here again, I'm seeing it in just an incredible way. The dedication, the innovation, and I would say what is particularly distinctive about this partnership with the Crann Centre is that you are true 2-gen from the beginning. Most of the time an organization begins this, they either provide services primarily from a platform to children or to adults. But you guys from day one were invested in helping families with neuro-physical disabilities, but helping whether the primary client was the child that had the neuro-physical disability or the adult. And that is highly distinctive. I have yet to see that happen in any other organization. And so that just it's just fascinating to see how you were doing that and how you're providing a system of care for the family, but when it's either the child or the parent that has the neuro-physical disability. So there's a level of complexity that you're willing to take on that's just interesting and hard and requires incredible persistence, but I think the outcomes you have already seen to be extremely positive, and I only see that trend continuing further.
So you made reference there to us using the 2-gen approach in a disability context. Have you seen it done in disability contexts elsewhere?
I haven't. I will say I'm not an expert in disability per se. I'm an expert in social and educational policy for parents and children. But as yet, I have yet to see a 2-generation model in any other place in the world that focuses specifically on families with disabilities, and in this case, neuro-physical disabilities. So it seems highly distinctive, but I won't say I know the whole universe.
Yeah. And just in terms of that distinction and distinctiveness, do you think it has a real capacity in a disability context, a two-gen approach?
Yeah, absolutely. I mean, from what I have seen of your work so far, you start with the core service need of an individual. Say it's a child coming in who has limited skills around wheelchair use, and you help that family increase it, but you recognize also the needs and demands on the caregivers, the parents, the mothers, the fathers, but also the siblings as well, and providing that opportunity for siblings to be involved when there's a huge complexity added to family when a child has a complex set of needs. And, raising children is hard enough, and when you add on those other complexities, people need additional care and support. And what seems to happen at the Crann Centre is that you provide this sort of family environment people are looking for, and a level of acceptance that you think about not just for that individual, but for their family and for their siblings. And I will say, on a personal level, as someone who grew up with a sibling with a pretty serious disability, it wasn't until I got here that I actually really thought hard about what an effect it had on my life. And I actually wish someone had talked to me about it when I was younger, but it was the kind of thing that really wasn't done. And I think opening up those conversations is going to create a dynamic and a change, not just for that individual who has the greatest needs, but their siblings, their parents. It's all part of a dynamic that we experience as members of families and community.
Really looking and holding the whole family and the importance of that. Thank you for sharing your personal story, Teresa, also. So just then to kind of come to an end on our conversation today, and just to shed some light on two-gen approaches more broadly, what's the biggest takeaway that you hope listeners will take from our conversation today?
I would say that it's absolutely worth the investment in the staff, understanding the complex needs of multiple members of the family, of funders to care that if they really want to create true change, that they invest in multiple generations at the same time, and that if we even think about policymakers thinking about changing the way we fund our programs, and whether that we coordinate and braid not only those funding streams, but how they happen administratively to make it easier for a family.
And that ties it right back to our beginning question around that ecological approach and addressing multiple levels, and lots to be done in all areas. So Teresa, thank you so much for your time today.
Thank you. It was a pleasure.
This podcast has been recorded at the Crann Centre. For more information about the topics discussed in this episode, please see the show notes in the description. For more information about the supports Crann provides to families living with neuro-physical disabilities in Munster, please see www.crawncentre.ie.